brachiocephalic trunk, and look here, this is going all the way towards the gland like this. Okay, now what is the difference that you can figure it out, guys? What is the difference that you can figure it out? Above, on the top, superior laryngeal nerve, okay, superior laryngeal nerve and superior thyroid artery, both of them were traveling like this. See, listen carefully, both of them are traveling like this, superior thyroid artery, superior laryngeal nerve. But the time gland arises, both of them separate each other. Okay, that is exactly opposite in the lower part. Lower part में क्या हो रहा है? ये inferior thyroid artery, ये recurrent laryngeal nerve. Initially both of them are far away. As the gland is approaching, both of them come together. Okay, there as the gland is approaching, both of them go away. Here as the gland is approaching, both of them come together. Why are you stressing on this? Why am I stressing on this? Is that whenever you are trying to remove the thyroid gland, you have to clamp the superior thyroid arteries, you have to clamp the inferior thyroid arteries also. Now when you are clamping this green one, ye dekho अच्छे से, when you are clamping this green one, don't you think you can also injure this superior laryngeal nerve? इसीलिए क्लैंप या कहां पे करना चाहिए? वेयर यू हैव टू क्लैंप इट? यू विल क्लैंप फार अवे फ्रॉम द ग्लैंड और यू विल क्लैंप नियर टू द ग्लैंड. Okay, you will understand this. I have not drawn the picture correctly. You will understand this if I show you this particular picture over here, because this picture is right, but the positions are not exact here, but these are the positions which are exact. Okay, so what I was discussing, arch of aorta, brachiocephalic trunk, you remember this? Here we have got, this is your internal carotid artery, this is your external carotid artery. From the external carotid artery, what was the branch that is coming? Your superior thyroid artery. And down here we have got here inferior thyroid artery coming from the thyrocervical trunk. Look at the superior laryngeal nerve. Look at the recurrent laryngeal nerve, guys. Just look at this. See, initially, let me write it down. This is your superior thyroid artery. Okay. See, initially the external laryngeal nerve and superior thyroid artery, both of them are moving close, but as the gland approaches, you see the distance between them is increased. Yes or no? Now if you want to clamp the superior thyroid artery, where will you clamp? Will you clamp at this position, right? Will you clamp at this point, or will you clamp at this part? I mean, I am trying to ask you, will you clamp the artery far away from the gland or near to the gland? Because far away, both of them are near to each other. You might injure the recurrent external laryngeal nerve, right? But as the gland is approaching, both of them got separated, so it is better to clamp towards the gland, okay, or near to the gland. So always remember, in case of thyroidectomy over here, where you have to clamp the superior thyroid artery, they will ask you this question: where will you clamp the superior thyroid artery? Away from the gland or towards the gland? You have to clamp it towards the gland, okay, near to the gland. That is a very important thing. Next, when it comes to the inferior thyroid artery, you see here, initially recurrent laryngeal nerve, and this is your inferior thyroid artery. Okay, initially look at the distance, guys. Initially they are very far, but as the gland is approaching, you see the distance. Now they have come so close. Now tell me, you will ligate it near the gland or away from the gland? You have to ligate it away from the gland. Okay, so the difference between superior thyroid artery and inferior thyroid artery ligation is, when you ligate the superior thyroid artery, you have to ligate it towards the gland, and when near to the gland, when you ligate the inferior thyroid artery, you have to ligate it away from the gland. These are the two important things which you need to know. So this wraps up the blood supply of your thyroid gland. Now when it comes to the venous supply, venous drainage of thyroid gland is very easy, guys. So just look here, there are three pairs of veins. There are three pairs of veins. What are they? One is called as your superior thyroid vein. Another one is your middle thyroid vein. Another one is your inferior thyroid vein. Okay, so there are three pairs, 6 veins. So this one over here is your superior thyroid vein. Okay, this one over here is your middle This is your middle thyroid vein, and this one over here is your inferior thyroid vein. Now you need to understand one thing. See, look here, don't confuse thinking that this is superior, this is middle, this is inferior. No. See, what has exactly happened here is that, look at the inferior thyroid vein. See, this is superior thyroid vein, okay? This is your middle thyroid vein, right? Now, inferior thyroid vein on the right side, inferior thyroid vein on the left side, both of them together, they form plexus like this. Okay, what is happening with both of them? Both of them, they are forming plexus, and together as a single vein they drain into, as a single vein they drain into a special vein over here. This is your left brachiocephalic vein. Left brachiocephalic vein, just look at this picture here. So you see, this is the inferior thyroid vein on the right side, this is your inferior thyroid vein on the left side. Both of them together formed anastomosis, and as a single vein they are draining into, what is this? This is your brachiocephalic vein, left brachiocephalic vein. Let me write it down. This is your left brachiocephalic vein. Okay, sir, then what is this artery, then what is this vein here, what is this vein over here? This particular vein over here is called as vein of Goitre. Okay, my pronunciation might be wrong, might be right, I don't know, but what I saw, I read it, vein of Goitre. Okay, so what is this vein of Goitre? Vein of Goitre is present between the superior thyroid vein and inferior thyroid vein. Okay, I'm sorry. Vein of Goitre is present between the middle thyroid vein as well as the inferior thyroid vein. Okay, so what is the use of this vein of, I mean, in which do you find this vein of Goitre in everyone? No, only few population you have this vein of Goitre, and this is considered as the fourth vein. Okay, and where is this vein of Goitre draining into? This vein of Goitre is draining into this particular internal jugular vein. Clear? So once again, just let's wrap it up. What are the important things? Venous drainage, three pairs of veins, to superior thyroid, to middle thyroid, to inferior thyroid veins. Inferior thyroid veins on both the sides join together, form a plexus, they drain into left brachiocephalic vein. Fourth vein we have got, that is your vein of Goitre. We have got vein of Goitre, and where is this vein of Goitre draining into? Your internal jugular vein. Okay, this is all you need to know regarding what is this venous drainage of your thyroid gland. Okay, right, next important thing I want to tell you, the clinical part which I told you, right? So here I have told you the clinical part when I was discussing the capsules. Okay, normally guys, when you wanted to remove the thyroid gland, not only arteries you clamp, you even have to remove the capsule also here. What did I tell you? Just look here carefully. I told you previously that if I have to remove the thyroid gland, I have to remove false capsule, I have to remove true capsule, उसके साथ साथ venous plexus जो है उसको भी निकालना पड़ेगा. Why? Because beneath the true capsule you have got this venous plexus. So when you're trying to remove the capsules, what will happen? This venous plexus might tear and lead to heavy blood loss. So इसीलिए you have to remove all these three important things during thyroid surgeries. But when it comes to prostate gland में क्या होगा? See, outside you have got false capsule, inside you have got true capsule, और इसके बीच में what do you have got? You have got plexus. You have got plexus. Okay, in thyroid, plexus is located beneath the true capsule, but here located in between. So if you, and this is your gland, this is your prostate gland. Now you tell me, if I have to remove the prostate gland, isn't it easy? Very easily I can remove the prostate gland without disturbing these three things. Yes or no? So the basic difference you have to know is based on the anatomy. You remove thyroid gland along with the capsules. Here you don't touch the capsule, you just remove the prostate gland. Okay, so this is the basic thing which you have to know over here. Okay, and next important thing is, in case of ligation, I told you, in case of ligation, what is this picture, sir, which you kept down? I'll come back to it in a minute. Okay, I'll come back to it in a minute, just keep this thing down. whenever you wanted to ligate, superior thyroid artery must be ligated close to the gland or away from the gland. They must be ligated close to the gland, close to the gland. But when it comes to inferior thyroid artery, this should be ligated where? It should be ligated away from the gland, close to the gland, and this is away from the gland. Okay, why? Because if you are ligating it, I mean, if you are not following these rules, what will happen is that superior thyroid artery ligation can lead to, superior thyroid artery ligation can lead to the damage of external laryngeal nerve. In the same way, inferior thyroid artery ligation, inferior thyroid artery ligation can lead to damage of recurrent laryngeal nerve. Okay, now what will happen if external laryngeal nerve is damaged? Then your CTM, that is cricothyroid muscle, is paralyzed. And if cricothyroid muscle is paralyzed, what is going to happen? Patient will have poor pitch. Okay, patient will have poor pitch, I mean the voice will be very weak. But if recurrent laryngeal nerve is damaged, then patient what will have? He will have hoarseness of voice. He will have hoarseness of voice. Okay, these are the two things you have to remember. Okay, and what is this picture about? This picture is very simple, guys. I just told you that this is your recurrent laryngeal nerve, right? What did I tell you? When towards the gland, the recurrent laryngeal nerve is very near, away from the gland it is very far. So how the recurrent laryngeal nerve is passing in different patient, I mean in different population, differently it will pass. Once it passes behind your inferior thyroid, in some patients it passes above, in some patients it passes in between, like this. Anyways, you don't remember this, no one is going to ask, I just kept it there. But you understood the main points over here, right? So these are the main important points which you need to know regarding your thyroid gland and its clinical points. Okay, so this is all. Thank you so much.